Hey guys, so today we're talking about whether you actually have good insurance. As a physical therapist, I hear this all of the time. My patient will be like, but I have really good insurance. But regardless of cost, do you really have good insurance? I mean, some insurance plans, their deductibles are so high that I don't understand the point of people having insurance to begin with, because you're paying a monthly premium and then you're paying the deductible on top of that, and that's just a crap load of money. And then some people have low deductibles and they have a low copay or a low co-insurance, possibly none. But do they really have good insurance? We're talking all about that today and more. Stay tuned. Welcome to Fearless Fridays, where we're talking about everything health and wellness related. My name is Dr. Melissa Chofi. I'm the owner of New Quest Physical Therapy, serving areas in New York and Connecticut. There is so much misinformation out there in regard to the medical field, and with our healthcare model turning more profit-driven, you guys as consumers need to be given all the tools you need to ask the important questions and demand you're getting what you need to ensure a strong, happy, fulfilled, and fearless life. My goal is to empower all of you to stand up for yourselves and be able to call bullshit in a realm that is confusing as fuck. Let's get into the episode. So we need to keep in mind what exactly your insurance is covering. Like, they could be putting a blanket statement about PT, but it's so many intricacies involved that it's not good enough to just say, oh yeah, PT is covered, because you need to know what that actually entails specifically. Another thing is there seems to be a lot of waste of time in between insurance approvals. So for example, if you're going to PT for, say, like 4 weeks, and then you run out of your visits, your PT needs to resubmit to insurance to see if they're going to approve more. So what happens is it usually takes like about a week or two for insurance to go through all their bullshit paperwork and then say whether they're going to approve you or not. And a lot of people will miss out on those 2 weeks of therapy because they're waiting for insurance approval. So at best, you could stay with the gains that you made in PT, and at worst, you can go backwards. And I had a patient actually who, it was just insane. So he fractured his tibia, and insurance approved. He had an operation to fix it. His insurance approved 8 visits for physical therapy. The man couldn't walk. The man was a avid skier. He worked out all the time. He couldn't even walk. 8 visits. All right, finished 8 visits. Let's see if we could get more approved. So before those 8 visits are up, your physical therapist needs to reevaluate what they found upon your first visit to see if you're making progress. And so you waste a whole visit. So you really are getting 7, because the 8th visit is spent redoing all your measurements. And then he had to wait 2 weeks for his insurance to approve, wait for it, 4 visits. So insurance also dictates whether they deem you're making enough progress and will continue treatment, or if they don't think your progress is good enough, and then they'll cut you off. So it's a game. So this is just one aspect of what is wrong with this scenario. Another thing is that payment between insurance companies and your physical therapist differs depending on what clinic you go to. So it's not like, okay, well, this is what we pay, this is what Aetna pays for all physical therapy. Everything's at a contracted rate. So depending what the clinic negotiated with the insurance company, that's what the insurance company is paying them. And I'm going to tell you, there are some really, really shitty contracts out there, and you don't know as a provider what that insurance company is going to pay you months after you've seen the patient. So you guys as a patient need to be aware of this, because, and I've seen this, and is another reason why I left the traditional model, therapists will treat according to how your insurance company reimburses. And this is a fact. And not all of them do it, but there are a couple bad seeds out there, like in any other profession. So I once worked at this clinic where the director literally told me, and she should not be treating, she told me this. There was an insurance company that we dealt with that only paid for an evaluation. So on an evaluation, they would not pay for exercise, they would not pay for soft tissue work, hands-on stuff, they would not pay for balance training. All they paid for on the first day was the evaluation itself, so just taking measurements. She said, well, I mean, that person had this insurance and they only pay for an evaluation, so I didn't want to waste my time, and I spent 10 minutes with her, and then I just gave her to the tech for 50 minutes and told them what to do with her for exercises. So yeah, this shit goes on, and unfortunately it's not illegal, but it's extremely unethical. So you guys need to be aware of this when you're basing where you're going for physical therapy based solely off of who takes your insurance. And I'm getting all fired up because it really, really makes me angry. And it's just insane that this is how things can be. Another thing that I wanted to point out with the contracted rate is that insurance companies are lowering their reimbursement for physical therapists every single year. I don't know why, but it happens. So the contracted rates are going down, which means that the clinic's making less money. They need to expend more money to keep their doors open. So what happens? They take on more patients at a time. So you can be in a clinic with a therapist, and your therapist is overseeing 3 or 4 people in addition to you in that hour. So a lot of times patients will slip through the cracks with this model, and they will not make progress. They are not being progressed. They're doing the same shit they did 3 weeks ago. And that's why they're in physical therapy for so long, is because they're not given an individualized program and not being overseen adequately. So again, when you think about, oh, my insurance is so great, all these PT places take it, it's so amazing, what are you really getting out of that treatment? And is it worth your time? Like, it might be cheap, you might have a $0 copay, but what is the point if you're not going to get better and you're going to waste 2 to 3 days a week for an hour basically doing what you could be doing at home if you just Googled your injury? Insurance also thinks that they're doctors and they like to dictate how you're treated. It's insanely ridiculous, and is another reason why I left. They're going as far now as telling providers what the treatments are and what they should be and what they will cover. So I've seen this, and this is just, it just blows my mind. There's one insurance company who every patient gets lumped into a category. If you have the same diagnosis as Bob down the street who's coming to PT, you guys are in the same category, even though you're nothing alike. So for stuff like lower back pain, they'll allow 40 minutes a week of exercise in PT. Mind you, it's been shown, research has shown over the years, there's a lot of research on this and evidence that exercise is one of the main things that prevents and decreases lower back pain in patients. So how does an insurance company know what you need as a patient to get better and prevent an injury from reoccurring? This, it just blows my mind that this is a thing. I had another patient one time that insurance approved a bunch of minutes of ultrasound for his knee, and they wouldn't let me put my hands on him when he needed hands-on therapy. And ultrasound, according to the evidence, has been shown to do absolutely nothing for recovery and for prevention of injury. So again, why are you telling me what my patient needs when I'm the one who's, first of all, educated in this field? You know nothing about what I do. And secondly, I'm the one that's seeing him every day. So what? You've never even met this person. It's mind-boggling. And finally, the thing that blows my mind the most is that insurance doesn't give a fuck about what you can and can't do in your everyday lives. So they're dictating how many visits you're getting in physical therapy based on a algorithm that the insurance agent or whatever is putting into the computer. So that's probably range of motion and strength of whatever joint is being tested. They don't look at your history. They don't look at your subjective complaints. They don't look at the fact that you can't pick up your child without screaming in pain. They don't look at the fact that you've been a gardener for 10 years and you can't because you're in pain. If you look good enough to them on paper, then they will deny you. They don't give a fuck what is holding you back in your everyday life. They just want you to be good enough to be able to function day to day at the bare minimum. And this is another reason why I left, because people were being limited in what they were doing in their lives, and a lot of people were giving up hobbies. They were giving up things they loved doing around the house. They were giving up things that they loved doing with their family because they just thought that, oh well, whatever, it is what it is, I can't be helped. And that is putting a huge disservice to everybody on society. I can't even speak right now because thinking about it makes me so mad. I haven't even been in the model. Haven't been in this model for 5 months, and it's just such a different world not working in an insurance-based clinic because I see things so much differently. So I'm the owner of New Quest Physical Therapy. We are an out-of-network practice, which means I bill my patients at time of service whenever they see me, and then I give them a bill that they can submit to insurance. Insurance will give them money back if they have out-of-network benefits. I was researching about this for years before I even decided to jump and do it. And everyone was like, oh, patients are getting so much better, so much faster. I can't believe it. And I'm like, wait, how is that even a thing? And I didn't believe it until I actually saw it for myself. So I had the patients that I've been seeing don't stay on my schedule for very long compared to what it was like when I was in a traditional model, and I see them for way less. I see most of my patients, depending what they need, most of my patients are seen one-on-one with me for an hour, maybe an hour and a half if they need it, and we only have one session a week. And it's just phenomenal how long they're staying. The longest patient I've had in this model so far was 7 visits, which in a traditional model would have been like 3.5 weeks. And most people in traditional model are put on for 6 to 8 weeks minimum that I've seen. So 7 visits, and she had an extensive history of problems with the ailment she was complaining about for the past year, and we got her back to doing everything that she wanted to do. And this is why when you're looking around for a physical therapy clinic or even a medical doctor, don't let whether they take your insurance be the first concern of yours. Everything else that I spoke about earlier should be your main concerns, because big shit if they take your insurance. If they do, you could be wasting very valuable time. You could be wasting a lot of money and stuff that you miss out on. You could be missing out on your life. And you need to ask these specific questions, especially now that we're going into the new year and health plans are probably changing, or even health insurance companies that you're getting, the benefits are probably totally different than they were a year ago. So just be aware of all of this within the next year and the upcoming years as things continue to change, and just really do what's best for you. I'm passionate about people getting their lives back and not settling for less. That's why I opened my clinic. That's what all of my education entails. I really feel for underdogs because I used to be one myself until I grew a pair of ovaries and started sticking up for myself. But I really want all of that for you guys, and I really, really believe that if more of us practice this way, our healthcare system in this country would be a lot better than it is. So any questions, as always, feel free to DM me or comment on this post, comment on my YouTube channel, find me on Facebook. And yeah, have a great holiday, guys. We're off until the new year. So stay fearless, guys.